Hi, everyone. This is Kylene with Parents for Public Schools of Pitt County. I'm so happy to be with you today to talk a little bit about the questions that parents have let us know they have about COVID procedures. We did collect these a few weeks ago, and you'll see there's lots of people on this call, so scheduling has taken a minute, but we're here and we have some update information to share with you. And I really just want to put out there, parents, first of all, you've probably seen the dashboard and the numbers are going down. And that means that we're doing our job. We're doing the things that we need to do to keep our kids safe. But I also just want us to know that the information shared today is not necessarily about why procedures are in place, but more just what the procedure is and how we as parents can really be a team with our schools as we follow those procedures. And for us as parents, we can have all the information out there, but until it actually happens to us, we may not necessarily understand what to do. So hopefully this will give you an opportunity to understand what to do if you have a symptom or a COVID positive in your household. We're going to start today just by learning who's on the Zoom with us. So you all know that I'm Kylene with Parents for Public Schools of Pitt County, and I'll let Jennifer introduce herself.
Sure. Hi, everyone. I'm Jennifer Johnson. I'm the Public Information Officer for Pitt County Schools.
I think we also have Lee Cutler on the line.
Hey there, I'm Lee Cutler. I am the Communicable Disease Supervisor at the Pitt County Health Department, and I've been the school liaison with Pitt County school nurses mainly during our season of COVID.
Thanks for being here. Karen Harrington.
Hi, I'm Karen Harrington, Director of Student Services, Pitt County Schools.
And then we have Lori Reed.
Hi, my name is Lori Reed, and I'm the School Health Program Nurse Manager.
And Amy Hatton.
Hello, I'm Amy Haddam. I'm the Deputy Director for Pitt County Health Department and also the Public Information Officer for the Health Department.
And finally, we have Ashlyn Elliott.
Hello, I'm Ashlyn and I'm the Communications Coordinator at Vidant Health.
Excellent. And parents and folks watching, you may not hear answers from every person on the call today, but all of these folks have some expertise about what we're talking about, just in case we need to tap into that expertise. But we're going to go ahead and just start with our questions. And Jennifer Johnson, I believe you're starting with our first question. So some parents have wondered, and it may be less of a wonder as numbers go down, but we're all still curious. What is the threshold that makes Pitt County Schools decide to close? And is there a virtual plan if the county or a school were to shut down?
Right. Well, as a communications person, I appreciate all questions and want everyone to know that we are as transparent as we absolutely can be and want to be. And so just thank you for hosting this today. But to answer the question seems to be asking for a specific number. So if there's a number, there isn't, if the person's asking for a number, there isn't a threshold of a number, but I would like to explain the processes. So I need to remind parents that, and our staff members, that decisions are made at the state level. So we are governed as a school system by the Department of Public Instruction. Last year during the pandemic, we had executive orders issued by Governor Cooper, and we also had our Board of Education makes local decisions, yes, but the State Board of Education and North Carolina Department of Public Instruction also put out guidelines in the form of Lighting Our Way. You may remember that. And then the Strong Schools Toolkit is put out by the North Carolina Department of Health and Human Services. So all of those are guidelines that our schools must follow. And so this year, the schools in North Carolina have been guided, commanded to, required to go full-time, face-to-face, 5 days a week, and have in-person instruction for all of our students. And so that's the guidance, and that is the that's what we're following right now. And last year during the pandemic, there was a requirement that we had to offer virtual options for families. That is no longer in the guidance. And so that is an option that is not something that's required and that parents have a choice. Now, Pitt County Schools did go above and beyond, and we did offer some applications to students as we expanded our PCVA, which is our Pitt County Virtual Academy. That was in existence before, but we did expand our teachers and expanded some spots, and some parents did apply for that late last spring. Now we're fully aware that, last spring, none of us knew what the Delta variant would bring this fall. And so we can't just expand PCVA to include everyone that would want a virtual spot. But I will say for Pitt County Schools that we did add some students on a case-by-case and a school-by-school basis to the Pitt County Virtual Academy, and really based on some medical concerns when the Delta variant did arrive and some numbers were increased. And so again, just want to say that while we do have the authority to maybe shut down a school for a day or two if there were some staffing issues, we have not had to do that this year. We did have to do that a couple of times last year for quarantines, et cetera. We really do not at this point have that option to close down all schools. And like you said at the beginning, we are seeing the numbers decrease. But what I really want you to know is as parents, look at the screen. We work with some fabulous people. We have a great relationship with the health department. We have a great relationship with Vidant, with our health providers here. And so if there's any threshold, I would say that all of those that I just mentioned, from the North Carolina Department of Public Instruction, to our state board, to our local board, to our health department, to Vidant, to our local pediatricians, and to parents that we have surveyed and have spoken at our board meeting, and we listen to you as well as a voice for parents at Parents for Public Schools. The threshold would be is that we would all agree, or that we would all, the majority of us would determine that it is unsafe for schools to be in person. And at this point, that is not the case. And then I think the other part of the question is, if we were to go virtual, what would be the plan? And that plan would simply be just as similar to last year. Our teachers are very familiar with that, and our students have a one-to-one access to computers at this point. And so that would be our option.
Thank you. I think lots of parents will be happy to hear that it's not looking like things are going to shut down. I know things can always change, but things are looking pretty good right now for staying in school. We did, as parents, receive some information from Pitt County Schools letting us know that calls will never go out, will no longer go out to the entire school when one case has been identified. Can you, Jennifer Johnson, talk to us about what's happening instead at this point?
Sure. Currently, and again, as things have progressed, currently you are correct in that there are not school-wide calls made for families when there is a case that's in the school. Those calls are just made to those who would need to be informed of a close contact and would be advised to quarantine, or a nurse would call and speak specifically about a case that would happen, but not a general call. A general call is not going to go out. Instead, I would advise parents to look at our dashboard, which is right on our website. We have a new website, and so you just go to the very top to the I want to button, and I think it's about the third little bullet down where you can find our COVID dashboard. That's the quickest way to get to it. And what you'll find there, instead of that general call, we now have a weekly dashboard that has our district-wide numbers of cases in our schools. That's school-affected cases, those that were on campus. We also have a dashboard of cases by school, and then we have a live real-time dashboard where parents can see what's happening at any time with cases and quarantines by school, and even by attendance area.
Perfect. And I know you all are sharing that dashboard on your social media. It comes out on Fridays. Parents for Public Schools is also sharing that when it comes out from Pitt County Schools. So parents, be sure that you find whatever avenue is easiest for you and access that for that up-to-date information. I think our next question is for Lori Reed. If a parent or other family member tests positive, what procedure should the child in Pitt County Schools follow? And then as a follow-up question, is that a different procedure based on if the child is vaccinated or not?
Okay, so if a student or a family member tests positive for COVID, the most important thing is to make sure that you contact the school and let them know. I would recommend that you call the school office and let them know that you need to speak with either the school nurse or the school COVID contact, so that therefore they can get some more information from you, and we can go ahead and give you the correct guidance for the situation in your home. The school nurses aren't necessarily on every school ground every day. We don't have a nurse in every building every day, but we do have trained COVID contacts in each of our buildings. We work very closely together. And it may be that the school has to take a message at the time that you call and get your name and your contact information, and you will receive a call back. It may be the nurse that calls you back. It may be the COVID contact that calls you back. But you will get a call so that you can get some specific guidance for your family. Now, if you do have a positive case in your home and you do have family members that are vaccinated, those vaccinated members would not have to quarantine by our CDC guidance unless they become symptomatic themselves. So if you have a family where maybe mom tests positive for COVID and you have a couple students that are in high school and they are vaccinated, they are able to attend school as long as they remain asymptomatic. They would have to provide proof of that vaccination, and at that time, then they could remain in school. Now, if that changes and they become symptomatic, it would be very important for them to then communicate that to the school that they are also symptomatic and that they are going to be remaining at home and also being tested for COVID. I hope that answers both parts of those questions, but the main key is just to please notify somebody in the school building, and it may be at the elementary level that the parent reaches out to the teacher, and that's fine too. Just so that we can make sure that we get all the information we need and provide guidance to that family.
Perfect. Thank you. And we've got a slightly different question, but it really is very similar. That was about a parent waking up in the morning, maybe with a positive test or some symptoms. But if a child in Pitt County Schools were to wake up and have any symptoms, a headache, a runny nose, a stomach ache, any symptoms at all that's not a broken arm, then what procedure does that child need to follow? And then does that change based on vaccination status?
Okay, so similar to the previous question, if your child is symptomatic, has some symptoms of illness, it is very important, again, that you go ahead and keep your student home from school and go ahead and notify the school. You can notify your school teacher, or again, you can call the school office and be directed to the nurse or COVID contact so that, again, we can give you that guidance. Maybe provide you some information with testing options for your student or options to get them cleared to return to school. And then if a PCS student has an exposure to a sibling in the home who is displaying COVID symptoms, the student may return to school as long as they are not symptomatic. So we don't have a policy in place at this time that requires for siblings to all remain home because one student is symptomatic. Now, if the symptomatic student does test positive for COVID, of course, at that time, those siblings would have to remain home. And again, we would need to contact that family and give them the specific guidance for their family quarantine. But until that time, they do not have to keep all their students home from school just because somebody has symptoms.
All right, thank you. It sounds like you all are going to get a lot of calls from parents and already have gotten lots of calls from parents. So I'll just stick that in that we're all very grateful for the work that you're doing to answer and return calls on a daily basis. I think we're going to move the conversation now over to Lee Cutler with the health department. Can you just tell parents places that they can go to get a COVID test that will meet Pitt County Schools requirements if their child needs to be tested?
Sure. We would first and foremost recommend that you go to your primary care provider or pediatrician office if able to. Secondly, Vidant has a pediatric COVID testing site that is appointment based. And if those are not possibilities, then Vidant has their COVID drive-through site that is basically first come, first serve. And then you can also go to an urgent care center.
Perfect. Thank you for that list. I see parents all the time wondering where they can go, and that was a really helpful list.
Sure.
I think, Lee Cutler, we're going to stick with you for just a minute. Can you tell us, are there benefits of going to a doctor's office to get tested instead of maybe the drive-through or the appointment with the Children's Hospital?
Sure. Going to a doctor's office, a person may be able to get tested for more than just COVID. So if they're having symptoms, they could, for example, have a respiratory panel done. So they're going to test for a lot more things than just COVID. And so you could be diagnosed with something other than COVID, such as something like RSV or the rhinovirus, the common cold. Whereas in the drive-through testing lines, you're just being tested for COVID. Perfect.
Thank you so much. I think we're going to move back to Lori Reed with a question about some more symptoms. So this question came from a few parents that were sort of nervous about testing negative, but then not also having a diagnosis. So if a child has a symptom like a runny nose and they test negative for COVID from a PCR test, but the doctor doesn't have a specific diagnosis from them, can they still come back to school and remain in school as long as their test was negative?
That's a good question. Sometimes I know our pediatricians have had this challenge at times. They said, well, I can't come up with a diagnosis. I'm not really sure, but it's not COVID. So as long as the student has been cleared of COVID by having that, COVID PCR test, as long as they've been fever-free for at least 24 hours with no fever-reducing medication, and that their symptoms have improved, they're feeling well enough to be at school, and they're not having any vomiting or diarrhea for 24 hours, they are welcome to come back to school once we have that negative COVID test result.
Thank you. That provides some really great clarification. I'm going to move now over to Karen Harrington. And Ms. Harrington, I know that we have masks on in the classroom throughout the day, but some parents wondered there's this one time a day that we've got masks off, and that's during lunch. So could you maybe talk a little bit about policies that are in place during lunch and what's being done to keep students safe? And does that vary based on age or vaccination status, or if they're an athlete, or if their class has lunch at a certain time, or are there things that change those policies, or is it kind of the same across the board?
So this is probably one of those things that may be frustrating because there's not a clear answer. It really is dependent on the school and the size of the school and the numbers of children that they might have to have in the cafeteria. And so what schools have done is really looked at where they can best get kids spread out during lunch, because that is obviously you can't eat with a mask on. And so that is the one time that we are having to sometimes then send somebody home because they would be considered exposed. So in order to reduce that, we try to look at, is the classroom better? Can we spread out more in the classroom versus in the cafeteria? Some schools might be allowing certain kids to go to the grade levels or classes, a few classes at a time, but again, trying to spread kids out in the cafeteria. So we just really are trying to look at what works best to try to reduce exposure. Some schools are even trying to encourage children to eat in the first, within those minutes of exposure, and then do their socialization afterwards by putting back on their mask as soon as they finish eating. So we're trying the best we can to limit exposures. And again, that's why we have continued at this point to still have the masks, because that does help us greatly reduce the number of kids that have to be quarantined. Did I answer all the parts of that question? Okay.
Yeah, you did. Thank you. Yeah, I know that's one of those things that this is our first time going through a pandemic. None of us were around in 1918 to figure out what to do. So there's a little bit of trial and error this year figuring that out. So thank you for that. I think we're going to stick with you, Karen Harrington, to just talk about, last year, we as parents got very used to having a lot of resources at home. There were curbside lunch pickups and there were virtual things coming home all the time. And that's different this year because we're in school 5 days a week. But if a family were to be at home or a student were to be at home because of quarantine, and maybe they don't have access to school lunch or things like that, what are some resources available to them? And why is it that we can't just drive up to the school and get lunch this week if our child's at home?
Right. So thank you for asking that and acknowledging that things are different. And so this year, again, when students are quarantined, they should have access to their device. And of course, that may take some coordination if the kid didn't already have a device at home. It was, a time that they didn't anticipate being quarantined. They should have an access to their device and work, but it won't look like it did last year in terms of Zooms and live instruction. Because again, we are charged to have kids face to face. So the instruction piece is going to look different, but assignments will be available so that they don't get as far behind if they feel well enough, of course, to participate. And then things like access to food, again, those were all under guidelines when we had students in virtual. And so we were trying to make sure that students that chose to be virtual had access to food opportunities. And there were differences in the federal regulations for our school nutrition program. And so they could offer that, trying to make sure everyone had access to food. But that is not available, just as any time in the past, if your child was sick or on weekends or holidays, we have not traditionally provided food. However, if a family has a need, we do have school social workers and great community support through Backpack Pal programs and other food opportunities that our school social workers are aware of, that they could help a family if they need assistance during a quarantine. When you asked that, there was something else. But again, our school social workers would be able to tie families, to those. Oh, and hotspots, I guess, was the other thing that, again, last year we had a great number of those hotspots. Right now, because families aren't working at home on a frequent basis, they might not have that. And we do have limited hotspots that during a quarantine we could access, but families will need to share that information with the school so that they can reach out to the school social worker or somebody help get them that device and a hotspot, so that they can access the internet.
Thank you. It sounds like we also need to give many, many thanks to our school social workers and parents. I've said this to you before. Send your school social worker an email right now, today. Introduce yourself, and you may not need them today, but you might need them some other day, and then you'll already know each other. So thank you to our school social workers for all that they're doing. We're going to move, I believe, back over to Lee Cutler. Can you help us understand? We all hear this word cluster all the time. Can you help us understand what that is and how Pitt County Schools is reporting clusters?
Sure. For the school systems, a cluster is constituted as 5 or more epidemiological linked cases over a 2-week period, so over 14 days. And epidemiological linked means that they are connected together through some common source. So, for example, a school may have 5 cases total wide, but maybe they're all in different classrooms. So that does not constitute a cluster. But now maybe they are all in the same particular classroom, or it all occurred through the same extracurricular activity, meeting, something like that. Then, and if it was determined that they were linked together in that manner, then that would constitute a cluster. And yes, it is being reported on the dashboard.
So it sounds like to know if there's been a school cluster throughout that week, take a look at that dashboard. That is a brand new one, is shared every Friday, but there are some live parts of it that you can look at throughout the week as well.
Correct.
And let's see, I think we are going to go back now to Karen Harrington. Some parents have asked, we had that whole screening process last year where we drove up in our car or we filled out a form before they got on the bus to answer some screening questions. And that's not happening this year. So maybe you could help us understand the reasoning for that not continuing this year.
Sure. Again, COVID is ever evolving, and actually late last year, almost towards, I think it might have been May, I might be wrong on that time, but we we were able to stop some of the screening, like the temperature checks. And so the toolkit has been revised, and even over the summer, we stopped doing the daily symptom screening. And really, they just did not find evidence that that was effective. And so what we use now, and what we've been, charged to use, is just our normal process when kids are symptomatic and we notice symptoms in a classroom, that we report that, and then, just do some more, I guess, clarification of what the symptoms are and are they COVID possible symptoms, and try to get some information. And then again, work with either your COVID contact or your school nurse to look at any needed quarantine.
Thank you. That's definitely helpful to understand. And one of our final questions is really just how can parents be sure that all staff are receiving the same information about COVID protocols, so parents can take action as soon as possible to work together with the schools and make sure that their child is contributing to the safety of everyone? And Karen Harrington, I think you might want to take that one.
Yeah, I'll start with that, and others might want to chime in, but I do think that's, again, why we wanted to thank you, Kylene, and Parents for Public Schools for, just doing sessions like this where we're trying to all get on the same page. We have tried to be consistent, but the guidelines do change. And so we try to communicate those out. We try to be really consistent. We are hiring COVID contacts. We have had COVID contacts within the building, but even our school nurses and the health department are doing this on top of other jobs. And so we try to have a consistent message, but there are sometimes subtle nuances for each case. So it may be that it feels like it's the same thing that you've already been through with another member of your household, but now we have vaccines, vaccinated individuals, and those that have been positive might have antibodies. There's always just something a little bit different. And so it may seem inconsistent. And again, we all may make errors at a time, and we try to be honest and upfront when we do that. But we can only go on the information that we have. And so it's this type of communication where parents just call us, tell us what's really happening, and we'll try to walk you through that to the best of our ability. But we do need everyone to just understand that, as you mentioned, this is our first pandemic. And so we're all just learning. And so please all, let's have grace, let's have patience and understanding that the school system is also under DHHS. I can't talk this afternoon, but we're under those guidelines. Our local health department, we're all working together to try to make sure that we're keeping kids in school and face-to-face. And that's really the focus of the guidelines this year. It's changed, but we want kids to be in school to the greatest extent possible. We do recognize it's frustrating, particularly those household exposures where people may have to be out for a long period of time. I think most of us on here have been through that ourselves in some way, and we understand. And we just ask for that patience and grace.
Thank you. That's really helpful. Before we close out, I wonder if anyone on the Zoom call with us today has any closing words, something else you'd like parents to know before we wrap it up.
Go ahead.
Sorry,
Lee.
Lori. This is Lee Cutler again from the Pitt County Health Department. I'd just like to second what Karen Harrington just said. And just so that parents know that there's not one particular entity that's necessarily making decisions or making calls in situations. Typically, we're all working together. Because again, as we've already stated, this is everyone's first go round with a pandemic. And we are wanting to do what we feel is the best thing possible for that child, that family, the school, and the community as well. So we have to take everyone into consideration. And again, it seems like every situation has just one little twist that makes it different from the one that we just talked about. So again, it's not just the school nurse making a decision or Pitt County Schools or the health department. It's all of us together. And again, we're trying to come up with the best decision. And typically we're probably going to err on the side of caution for prevention. as opposed to just hoping that we're not going to allow something negative to happen. And again, thank you to all the parents for, this has been a 1.5-year struggle. So, I mean, I'm a health department worker, but I also have a child in the Pitt County Schools. So I definitely feel the stress of that as well.
Lori, did you have any words to add? Did she take them out of your mouth?
Yeah, Karen and Lee have done a great job of summarizing everything. You know, again, I would just reiterate that our goal is all the same. We want our students in school. We want them safe and we want them healthy. And we're really just working together to try to make sure that happens.
Thank you to everyone for joining us today and providing such great information. Parents, I just want to say to you again, thank you for all that you're doing. We do continue to watch that dashboard and see those numbers go down from what we were seeing at the beginning of the year. And that means that we are working together. We are following the guidelines of teamwork. And so I just encourage you to continue to do so. These folks are so willing to answer questions. Your schools are so willing to take a message, call you back, give you whatever guidance you need. So let's remember that to be engaged parents, we don't have to be in the classroom. We can create relationships, through phone calls, emails, and make sure that we're just staying in close communication with our schools, so that we can all be a team and continue to not only stay safe, but stay in school. I know my kids are loving being there every day. So I just encourage you parents to continue to display that teamwork with our schools. And thank you for doing that. And thank you to everyone in our schools for all that you're doing to provide a great school year for our children. Have a great day.